Hello friends, how are you? Today I will tell you the difference between taking old technology measurements and the measurements that are done with the new 3D scanner. Why are they more popular today? Why 3D scanners? Earlier, when we used to take measurements or did measurements somewhere, after cutting a tooth, a measurement was taken from it or one of them. The tray was put in your mouth, the material was put in your mouth for about 45 seconds or 1 minute. After that, an impression was taken. A dye stone was added to the impression and it was dried. So a map of your death used to be made on that, and then there were postal fabrications in the lab. So friends, Dr. Praveen Bhagia, today I will tell you what is the difference between the two. What is a 3D scanner and why is it different and what are its advantages? So friends, this is our facility at the clinic and what is done inside it, that all your things are fed first. What is the requirement, what the shed will remain, and then from a 3D scanner. A complete print of a mouth is taken. When the complete print comes also of upper and lower, and your white registration is also done from the same, when you close the mouth, then how much difference is in the cut tooth and in the original tooth, then it indicates to us how much ceramic height to keep. After all these things are fixed, we store it and there is an STL file which goes to Direct Lab. The same need not to come to collect the models that were made earlier, or the lab guy used to come here before that. There was a possibility that it could have been a shrink, but when you are taking measurements from a computer, you are taking measurements from a scanner, then the question of shrink does not arise. So after that, when we send them for the scanner, they confirm that you can proceed with the majorness, then above them through the CAD/CAM, ceramic teeth, PFM teeth or zirconia teeth, whoever wants to make a monolith, then that is my separate video for the types. Will you ever see what types of frames are? So when it is done, then believe me, what I have been doing for the last 1 year, accurate fitting comes from the 3D scanner as soon as you keep the cap exactly. Along with the fitting, the proximal space that used to be between the two teeth also does not remain, because through computers it also tells you undercuts that there is a need for cutting here. Then we do the correction already so that these problems do not come later. So if the difference is accepted, then that. Speaking of the first impression, people used to gag inside him, vomit. When someone has a vomiting feeling by putting a finger in the mouth, then when the material inside is filled in your mouth and it stays for 45 seconds or 1 minute, then definitely there is a problem of gagging or vomiting. The second lived. His smell was not very good, because when a smell patient has put the smell very close to your mouth, then you will definitely have to feel it. And even if it happens, then you are saved from both things. And thirdly, when you completed the measurement after you put the dye stone out of it and took out the teeth, 1 or 2 teeth were broken, you were called again, then measured again. So these are very good features in the scanner. I'll show you a live demo, what happens, and after that. You can avail that facility, which is little, and clinics, they have this facility available, and capping does not matter much. 400 makes a difference of ours 500. It is expensive, but you are not compromising with accuracy, and at the same time, you are getting a best cap, which is to stay in your mouth for many years. It is just like the natural teeth. So if you have any question, any confusion, you can contact me anytime. And if you need the facility of 3D scanner, you need the facility of making teeth of comparator computers, then you can contact us. Also have a question. Do you have a photo of yourself and tell me where you live? You can WhatsApp me. My numbers are given below. You can WhatsApp him. I will try to address as soon as possible. So thank you very much for watching. If you really like this information, share with your friends. Information can reach more people. Don't forget to subscribe to you and my channel, Bhatia Tentopals, who haven't yet. Friends, you take care of your teeth. Teeth will definitely take care of you. I am Dr. Praveen Bhatia, Senior Dental Surgeon for almost 30 years. If you want to ask me anything in this dentistry, you can WhatsApp me. And my clinic is in Janakpuri, Delhi. If you visit in the name of Indian Dentopulse, then I can clear your all doubts. Thank you very much for watching similar videos and keep getting your love. Thank you very much, Generate.
Generate by AI.